Kristen, welcome. We are beyond excited to get to be here with you today at Under One Roof.
Yeah.
Recording, not live, but pre-recording a podcast episode.
And together instead of just on Zoom, which
Yes.
is super exciting.
It
Thank
is.
you for having me.
Our pleasure. It's been our pleasure. Okay, so for those of you who don't know, Kristen is a biological hygienist, of course, but you kind of specialize in microscopes. This is your jam. A lot of hygienists may or may not even know that technology exists for clinical applications. Kind of give us like a brief rundown of why would you want a microscope in your practice, and what are the benefits of it?
Oh, wow. Where do I start?
Wherever you want.
Oh, there's so much. Okay, so it is a phase contrast microscope.
What does that mean for those who were not biology or microbiology nerds, like all of us here?
I mean, I would just say it's a microscope that you can see live cells, live movement. So some other ones you have to basically stain it to be able to see it, and the staining kills live cells. So that's why it does need to be a phase contrast, so that we can see live movement, which
an
is
important
where the
distinction.
magic is, all the fun is, right?
And the phase contrast is how the light's coming in through the microscope. Yeah.
Yes. So it needs to be that type of microscope. Why are we doing it? What are we doing it? You're basically taking a plaque sample from the patient, so a biofilm sample, putting it on a slide and giving the patient a tour of their biofilm. So what's actually living in their mouth.
And they're seeing it in real time.
They are seeing it. We are all looking at it together. Yes. And it's so motivating. So you're assessing their risk of disease. So not only oral disease, but systemic disease. So I think that's a really important way it automatically bridges that oral systemic link. Like you can't not talk about oral systemic with a
100%.
microscope. So it just is the most beautiful transition. I mean, don't you feel the same way, Heather? It's a beautiful transition into oral
was
systemic.
life-changing for me. And
Okay.
I am so excited about this conversation today.
So we're all hanging out at the IOMT booth. I think this was maybe day one, and another hygienist came up, and she was using the microscope.
Yeah.
And I was listening to you two talk, and she said, oh, my word. She said, I was kind of ready to get out of clinical. I was kind of burned out. And she said, then when we started using the microscope, and it kind of changed the way I practiced, she said it was like a whole new life. And my ears perked up because that was exactly my experience.
That was mine. Yeah.
Same?
Yeah. I was burnt out of dentistry, moved into a biologic practice. They didn't have a phase contrast microscope. And then your eyes are open because there's some crazy stuff like kids with ortho that are like all this overgrown, crazy tissue, and they don't have a lot of pathology, but they have white blood cells all over the place, and they're having a reaction to the metal in their mouth and maybe some hormone issues, and they're pro-inflammatory based on just a systemic inflammation process, and it has nothing to do with pathology.
And I think we literally talked about this situation. I had this very patient come in, like teenage boy, like gums puffy, but not gingivitis puffy.
Yeah.
And I have a new grad doctor, and he's like, oh, this kid's not flossing. And I'm like,
There's no plaque there.
I'm not.
Yeah.
No, this isn't a flossing thing. But you know what you know, right? And you see what you see. And I mean, this guy's only had like 2 years of actual clinical in school. So I was just like, no, I've actually seen his brother. Like, this is a family thing going on here. But we don't have the microscope to do this, to look into this. It gives you so much more insight. I could only imagine
And
what I
there's
would
pros and
see.
cons, right? Like phase contrast microscopy, like when patients see that stuff, they have to own up. Like, this is what I'm growing in my mouth. Like,
Isn't it like, I always tell people, it's like the intraoral camera, except for biofilm. So I think we all,
Who doesn't
maybe
love
not.
the camera?
like, I can
Yeah.
remember back in the day, like that wasn't a thing when it first came out, and
Right.
how motivating it was for patients to just, oh, I see it. Okay, when can I get on the schedule?
Yeah.
So I feel like the microscope is very similar to that. As they see it, they own it. All right, when can I get in, I guess? When are we going to do this thing? So it, besides all the really important,
yeah.
let's get well, let's get healthy, it's just such a motivator for people to own it and go, okay. So to seek treatment, but to also modify behaviors. And then you get into these great conversations. Okay, what are you doing each day?
Yeah.
What are you eating? How often are you eating? You know, what are you
And
drinking?
like breaking down biofilm, like on the microscope slide, you're going to see, I talk about this all the time, like comparing on the bristle test, because the bristle test does have call outs on chain draws and cocci and spirochetes. So I like one of the things when I started, because I was working with a phase contrast microscope, I was like, hey, we have this great test. You give these attributes. Can we put the shapes in there so I know what I'm looking at on my microscope? So part of like some of the things I do, because we have so many phase contrast microscope offices that are using them, like I can teach you a little bit about what you're looking at, because some of us think just movement is terrible, but some stuff are biofilms. And if you have a huge biofilm, like chunk of plaque that's not moving, that could be problematic too. So like we can pair the two together really nicely to really understand what we're looking at, and make sure that we're subsiding it. But super fun, even in kids, right? I get excited about teaching, and when you're in a holistic practice, there's a lot of homeschooling parents, you know?
Yes.
I'm like, want to do an experiment today? Like, it's beyond brushing,
like,
right?
yeah.
Like, let's just talk about your brushing and your flossing and why. Let's look at the bugs in your mouth. That's kind of like, and then there was a certain age where, you know, like the little ones are like, that's in my mouth, you know? So I kind of learned to like back off a little bit, but some of the other kids, like, what a cool science lesson, going to the dental practice and looking under a microscope at pathology.
Well, and also this is a good time to bring up, guess what? It's not all bad, right? Like, hey, there's good guys. What are we going to do to kind of encourage this beneficial bacterial growth?
Right.
So I feel like it goes both ways.
And
right?
that's why I do think you have to test too. And you see, like, it's really like having a clearer, a less busy, and you're always going to have bacteria on there. But if it's full of chunky stuff, like, that's probably bad, right? If there's a lot of not mobile things on there, that's still dysbiosis. Yeah. And then if we have spirochetes, and Porphyromonas gingivalis is a swimming microbe. It's those little swimming rods jetting through. Super fun. Trinella is also a swimming bacteria too. So when we start looking at that, we still have to test, because we don't know what we're looking at. We can get an idea, but that's where the diagnostic part comes in. But the microscope gives you a beautiful understanding of, is there dysbiosis? And should we be testing to get a better idea of what's going on? So they pair beautifully together.
Yes, I think the microscope is a great way to nudge people to get that done too. Yeah. To get the salivary testing done. When you're like, I really want this, and they're like, Yeah. Well, okay, let's look. Ooh. Okay, I guess I'll get it done. Yeah. We want to know exactly what's in there.
And it's a check-in for the clinician, right? Like,
that's a good point.
When we're doing our therapies, did we obtain good control of the biofilm? So with something you can't do with salivary testing, you can easily grab another slide at the end of your treatment. If I did a SRP therapy, right, I can grab another slide, drop into some pockets, grab a plaque sample, put it under a microscope, and see if I disrupted the biofilm effectively. And if I didn't, guess what? I'm going back into the pocket.
Right now, I'll go back in there.
Yeah. It's not one and done. And at the 6 to 8 week visit, if you're doing a recall, to check in, it's beyond just bleeding. I had one patient, super cool. Like, I did all these therapies, and then I got him to a 6 to 8 week visit, and I had spirochetes and amoebas, which you can't test for amoebas. There is a couple of tests that will show amoebas, but the Bristol test won't. He was in dysbiosis still at a 6 to 8 weeks. So all of the laser ozone GBT didn't work in the therapies that I gave him, because his home care wasn't effective. Okay. He picked up some stuff, right? But his tissues like pink stippled firm. So if I had just gone by clinical view, like, the inflammation is gone.
It's gone.
He's going to go back into cycle because I didn't obtain good control of the biofilm.
Absolutely. And I feel like we all know biofilms change all the time.
Yeah.
So it's nice to have something that's a quick, we're trending, yay, or what's going on? And I personally always found after the holidays, forget it. It's just a
diet.
It's trash, everything. It's a dumpster fire.
And patients know. Patients know, especially after like Halloween. They're like, oh, I'm sure I have a cavity. And I'm like, a cavity is the least of your concerns at this point. Let's just
Christmas time too. Like, all the baked goodies that come in. Yeah.
Well, and it starts, right? Like, it starts at Halloween. And so everybody's doing the thing. And then we roll into Thanksgiving.
And then it ends.
And then it's in December. So we're still.
The beginning of school. Let's just be real.
Right.
It goes all year.
Yeah. It's like sugar season, and then
And let's just talk about like sugar, not just candy and soda. Feed
Simple
pathology.
carbohydrates.
Beyond just the caries.
Right.
Right? So pH and sugar feed pathology. Protein and fiber feed our good guys.
Yes.
Which we're all about.
Right. And I think that's an important conversation to have, like nutrition wise. I mean,
Yeah.
don't you guys feel like just conversations on nutrition and how frequently you're eating and really trying to control pH is huge for patient biofilm, like really helping them get control of their biofilm?
You have to control the pH.
You do.
I preach that all the time. If you don't control the pH, you're never going to get the biome under control. There's a really cool study. It's just a tiny study that I have in some of my slides. It's 125 people, so it's pretty small. But they did a whole like pH test stripping on people with perio and in
For
different
those who are
stages.
listening, by the way, when Heather says stripping, she
Oh.
means pH
Sorry,
stripping.
guys. I'm not really stripping.
She does. She just blatantly says stripping. And I'm like,
stripping someone.
let's clarify this.
Sorry, guys.
Heather's not a stripper on the side.
Thank you. Yes.
In the
yes.
way you're thinking.
I love to pH strip people.
Man, got to get those bills paid.
Oh, biological dentistry
Thank
2.0.
you, Amanda, for clarifying that. Yes. I forget that. We talk about that all the time. She's like, we're stripping again. Just so you know, Amanda has gone on the stripping.
I am now a stripper too.
Yes.
But
Stripper.
from Amazon. I don't know if that's worse, but
Yeah,
yes,
yeah.
I get my stripping from Amazon.
So that study showed that pH will be at like 6.25 in your more severe perio. And that after treatment, that pH will come up to a more even level around 7, which is where you want to be, is right around 7. So just if on a simple biologic aspect, if we're just stripping,
Like I'm already thinking of names for this podcast. Simple stripping test with Kristen King from Thailand.
you're helping to control. So I talk about xylitol and like nitrates. We have to bring our nitrates up because that will increase pH too, and that sort of thing. We have to pay attention to pH. We can push the microbes by adjusting pH in the mouth. Makes a huge difference.
Okay, so I feel like I just had this, like, as we're talking about all of this moment, all the things that we talk about with our patients, back to that whole feeling like you really love hygiene again. I feel like this biological approach to hygiene and this strong emphasis on prevention and digging deeper and putting your detective hat on really helps you go into this. I am a healthcare provider.
Yes.
I'm not
It's a
a
paradigm
mouth
shift.
janitor. Like, yeah, you're like, no, I'm a detective.
Mm-hmm.
I'm your oral health detective, and I'm also, I'm your healthcare provider. And I have found personally, when you start to address patients that way, like they lean in. They love it. Like I lean in, they lean in. Like it's a really beautiful. We just want to all work together to get them well, and not just the mouth, the whole body, right?
I think that's like the slight buy-in. I think there's a lot going on in the hygiene world right now, politically, right? We're all like still slightly on edge about the whole assistance can scale. And I feel like it undermines a lot for hygienists as healthcare providers, right? Because if our job can be just reduced to like a quick weekend course or just study under a doctor for 2 years, whatever,
Or
It's-
120 hours.
or whatever, yeah, or whatever they're reducing our education to. This validates it because this is putting our education to work in a very practical root cause manner that's addressing whole health. And that's really where dentistry has missed the mark. Not even just hygiene, but dentistry has missed the mark
Oh, yeah.
because it's
Great.
it's not truly about prevention. Putting fluoride
It's
on teeth,
reactionary.
it's reactionary. It's not preventative. And I mean, dare I say, our whole healthcare field in general, our medical care in our country is not prevention-based. We have a sick model, not a wellness model. And biological hygiene, I think at its core, is that paradigm shift that those patients do want.
Yes.
These aren't the patients that are like, oh, I only want my insurance covers. Like,
yeah, no.
I don't give a crap what my insurance does or doesn't cover. Like, if my health isn't there, I'm going to pay whatever because
And a lot of
I
people,
wanna keep my
a lot
teeth.
of people end up in biologic hygiene or in a biologic dental model, and they end up in the biologic functional medicine model for the same reasons, because they're sick.
yeah.
So we deal with a lot of sick people who are dealing with what is the root cause of my problem. And we can't claim that we're going to fix things necessarily, but I've seen some pretty amazing results.
Very
And now
amazing.
being paired with a functional doctor and working on the oral microbiome, like reducing CRP. And that the article that I talked about, they had another side, like part of that where, when we changed the pH and treated patients, it was impacting A1C and lipids and
Right.
blood pressure. Like they had 4 different health categories. Insulin on that bucket of patients of 125 people, it correlated with their cardiovascular disease, their A1C and insulin resistance, their lipid panel.
Yeah.
And when we treated perio and got the pathology under control, now because you've worked with a microscope and you've seen healthy people have dysbiosis, right?
Yes.
I'm kind of even wanting to change the thought process of we shouldn't just be checking our perio patients because it's still a little reactive.
It is.
Totally.
Absolutely.
We could test and look at the biofilm way before disease process happens, and we're actually preventing oral systemic disease pathways. That's prevention.
Exactly.
That's prevention.
Well,
Exactly.
that's the idea.
Yeah.
You test everybody, right?
Yeah.
And then hopefully you catch it maybe in the very beginning, but there's no clinical signs of disease, right? Like the probe depths are great. There's no
Right.
bleeding, nothing, but you're like, it's dysbiotic. Hey, let's intervene now. Let's do some things, have some
Correct.
conversations, get it back and get to good and healthy before any clinical signs of disease. And
Before the
that's
radiological bone loss
Yes.
happens.
And isn't
Right.
that the definition of prevention?
I kind of, that's one of the boats that I kind of like talk about all the time because right now preventative dentistry is reactionary. Like we have to have 30% bleeding before we do a 43, 46. Almost half the mouth has to be
Right.
bleeding and inflammatory before we actually call that gingivitis.
Yeah.
And with the bristle test, sometimes people are like, oh, I just have like 1 4-millimeter pocket or one, and their biofilm is out of control. I'm like, they're headed towards disease.
Right.
I had one patient I've been working on, and she's got a very difficult score to shift. There's something else underlying going on. So I did refer her to a functional nutritionist to try to work on some stuff. But I tried to get her to advocate for a laser in her office because her scores indicate that she would benefit from either desiccation or laser, something to help us like clinically with the biofilm. Something's going on in that area.
It's not right.
And her dentist is like, I'm not going to do that. You have pink stippled firm tissue. I'm like, but look at her. Look at her
Did you ever
test.
say no?
No.
Why would
Right,
you
like,
say
why
no
would
to
you-
that?
Well, how cool is it when you have an oral health coach saying, hey, your pathology is out of control. You're at systemic risk. Even if you don't have bleeding gums, desiccation therapy or maybe using a laser bacterial reduction process in your office would be great. And having someone come to your office and say, hey, I talked to my oral health coach and she said my oral microbiome is a little off and it might be in your best interest to maybe add a laser to my therapy today. Or she talked me about desiccation therapy. Do you offer that in your office?
I'm with you. Like, why would you say no?
Why would
Literally
you say
someone
no?
gave you a gift of treatment that you didn't have to, like, here's some production that I did absolutely nothing.
Right. You didn't have to convince
I
the
say
patient.
thank you.
Right.
Thank you for sending them my way. Please send
So
them.
I'm trying to teach, like, if we have and she's systemically sick. So she's not presenting
I mean, and this is
clinically.
not the first time. I feel like we hear this over and over again, right?
Yeah.
Like, come on.
This is truly where like the pavement meets the road, right? Like hygiene school, it's pounded in our head, oral systemic, but I feel like we turn a blind eye to systemic oral. You know what I
Yes.
mean?
Yeah.
We're like, oh, well, yeah, but I don't have to look at that. That's not my area.
Right.
It's like, but we need to take that into consideration when we're having conversations and looking at treatment plans with patients, right?
Yeah.
I mean, the new periodontal staging and grading, we have to take medical history into account, but
Yes.
just with perio, not with gingivitis.
And
Technically,
you got to
right?
take that in. We should look at it
You
for caries.
should. You should look at it for caries, but it's not.
that's it.
Okay, guys, this
All
is a
right.
phenomenal conversation that I feel like we could probably sit here for hours and
I
talk
was
and go in
Because
circles.
I have like 5 things going through my brain, so we will put a pin in it and come back.
And
We will.
yeah, we got to do episode 2.
Yeah,
we will.
we'll do it.
Definitely.
And you'll have to join us from Bangkok.
So, Kristen, obviously, Heather just said Bangkok, but for not patients, maybe patients that want to talk to you, for other hygienists or dentists listening to this podcast that want to know more, give us a little synopsis what you do. You obviously have that passion for microscopy, but what is the service that you provide to help offices bring this into their practice?
So I will Well, my company's called Dental Reveal, so
Yeah.
check it out at dentalreveal.com. I hang out on Instagram a lot, Kristen King Dental Hygiene. But I help train offices on how to implement that microscope and teach them how to assess those biofilm samples for risk of disease, motivate patients. I've got an online course. I love the online course because it's kind of yours to keep forever. It's great if you just want to go back and check in, but it's really good for onboarding new team members, because I did discover that, like, as you add new team members, it kind of does fall to the hygienist to train them, and then you're also still trying to produce at the same time. So to have them go through the course and be up and running and have the knowledge, and then come into the office, and then you can kind of help them out from there. I did discover also, I like to travel. Not everybody likes to travel. 2020, not everybody could travel. And so that's the other reason, is you can, watch it from the comfort of your home and your favorite jammies if you want to, review it, or in your office. So if you don't want to take, or you can't take the whole team to travel, I think it's a great thing there. And I do think the whole team needs to be aware of what's going on. I'm not saying they need to know everything, but it is important that the front, we're all on the same team. The front does need to know, this is what we're doing. This is why. Do not go to the bathroom and brush your teeth and dispose of the evidence. Absolutely not. Get in there and let's look at what's really going on.
Yeah.
So that's another reason why I like the online for those. And then, but I'm always open for conversations. I can help source microscopes, all the things.
Awesome.
I found a new one this weekend.
Thank you for being such a great resource, Kristen. And thank you for being available to help us at the IOMT booth.
Yes. Been
educating other hygienists.
Fun. I had so much fun. So thank you.
No, thank you.
Yeah. She's like
all right.
one of my dental soulmates. I love it.
Dental nerds unite.
That's pretty much what we are.
So I do want to just say, not a problem. U.S. training, fine, even from Bangkok, because she does have the online option. So don't let that deter you from picking Kristen too. And she's phenomenal. Definitely amazing. So
Thank you.
And we'll definitely have you again on the show. So thank you
Thank you for having me.
Thank you, Kristen.